While new U.S. cases of COVID-19 spike to record highs, a worrying trend is emerging. Diagnosed infections are soaring among younger people, with the majority of new cases in several regions now being seen among people under age 50, with significant increases among teens and young adults. Without new or renewed efforts to control the spread of the coronavirus, the skew to younger carriers will likely initially cause the death rate to fall, since the virus is deadlier for older people, explains Thomas Tsai, MD, a surgeon and health policy researcher at Brigham and Women's Hospital in Boston. But the overall rising number of infections will likely drive the daily death toll back up again eventually, due to sheer numbers of infections. The trend could cause the pandemic to get even worse this fall, Tsai and other health experts say. Nationwide data on COVID-19 cases by age group is complex, buried in reports from the U.S. Centers for Disease Control and Prevention, and it's currently only through the end of May. Tsai, also a researcher at Harvard T.H. Chan School of Public Health, has pawed through that data and has a preliminary bead on what's happening. There is definitely a shift to the younger groups, he tells Elemental. That's becoming more evident across states and nationally as well. Examples of the trend are found in some state and local data. Arizona, through March 30, 40% of cases were among people under age 45. That cumulative figure has grown to 60% today, according to the state health department. Cumulative cases among teens and children rose from under 3% to 11% during the same time period, while among people over age 65 it fell from 24% then to 13% now. Ohio, the average age for new cases has fallen from about 60 early in the pandemic to 47 today, says Robert Salata, MD, a professor of medicine in epidemiology and international health at Ohio's Case Western Reserve University. The main causes are increases in large gatherings and people not wearing masks, Salata says in an email. Dallas County, Texas, almost half of new cases since June 1 have been among people age 18 to 39. The state reported a record 5,489 new cases June 23. The hospitalization rate is at an all-time high, says Governor Greg Abbott, who has been reluctant to require face coverings or reinstitute stay-at-home orders. The coronavirus is serious. Florida, the median age of people testing positive for COVID-19 plummeted from 65 in early March to 36 this week. I think our older populations are taking more precautions, protecting themselves a little bit more, says Cindy Prinz, Ph.D., Associate Professor of Epidemiology at the University of Florida. And I think that our younger populations have moved back into the community as these stay-at-home orders have been lifted. The trend is showing up, at least in early data, in hospitalizations, too. In March, 82% of people hospitalized for COVID-19 in New York City were over age 45, according to Scott Gottlieb, former commissioner of the Food and Drug Administration. Now, 50% of COVID-19 hospitalizations in Dallas are under age 50, Gottlieb says. The overall rising number of infections will likely drive the daily death toll back up again eventually, due to sheer numbers of infections. What's going on? In comparison to other viruses, this coronavirus is particularly wily. It spreads readily, mainly through close contact and even through the air, especially indoors. While it can be debilitating and deadly for any age group, the virus frequently lurks unnoticed in some people, especially younger people, presenting only mild symptoms or none at all. In that way, it hops from person to person, sometimes causing dozens or hundreds of infections in a single superspreader event, and anywhere from 2 to 14 days go by before anyone realizes what's happened. Researchers do not think the virus itself is morphing or mutating in any way that's causing the younger skew. Rather, SARS-CoV-2 is simply taking advantage of opportunities Americans present, as lockdowns have been lifted and people, particularly younger people, have resumed many normal aspects of life, in some cases dismissing the seriousness of COVID-19 and eschewing masks, physical distancing recommendations. There are three specific factors that could explain the age shift, according to Natalie Dean, Ph.D., an epidemiologist and assistant professor of biostatistics at the University of Florida. Older people are being more cautious. Young people are being less cautious. More widespread testing is capturing more of the mild and asymptomatic cases, which tend to involve younger people. With severely limited testing capabilities in the early months of the pandemic, often only people with severe cases were tested. The reality is almost certainly some mixture of all three explanations, Dean says. This concerns me both for the health of these young people but also for how it will affect their communities, as young people can inadvertently infect others. Concerns the pandemic could worsen each of these scenarios has different implications for the ongoing spread of the virus, Dean explains. For example, if young people are becoming less cautious, then more young people will see severe consequences, including death, even if the odds don't change for each individual. And they will be more likely to spread the disease to vulnerable populations. This concerns me both for the health of these young people but also for how it will affect their communities, as young people can inadvertently infect others, she says by email. Other scientists as well as frontline doctors are similarly concerned. Younger people often feel that they are invulnerable to harm or danger, and that nothing bad will happen to them, says Glenn Fennelly, MD, a professor of pediatrics and microbiology at Rutgers University. Because of this, they may discount the importance of physical distancing and wearing masks. Tsai, the Harvard researcher, is concerned about a potential confluence of rising COVID-19 infections among younger, sometimes asymptomatic but infectious people, and the start of flu season this fall, potentially overloading hospitals across the country. The United States has missed its opportunity to contain the coronavirus, he says. Now mitigation is crucial: masks, social distancing, testing, contact tracing, especially over the next 2 weeks. The worry, he says, is that as kids go back to school and people spend more time indoors, the rising number of cases may serve as a reservoir for community transmission, and unabated will lead to an even more significant pandemic in the fall and winter.